Public Health Sudbury Districts released data from the Community Drug Strategy on Drug Toxicity Surveillance. CTV's Madison Marier has more.
The Community Drug Strategy released data from January to October of 2025, indicating a slight decrease in drug toxicity deaths.
Local data suggests that from January 2025 to October 2025, there have been 102 drug-related deaths. In comparison to the same period, so 2024, January to October, we saw 117 people that have died from a suspected drug poisoning.
Rezo Access Network said a decline in overdose deaths alone does not mean the crisis is improving. It highlights the urgent need to strengthen integrated responses in Northern Ontario, including harm reduction.
Healthcare is the #1 responsibility of a provincial government, and right now they are failing. They failed 102 people in the first 10 months of this year, and they fail, as I said, an average of 2 people every single week in our community.
We still have a long way to go. Substance use was increasing since around 2005, though not as quickly. Given it has been a concern for 20 years in the making now, this sadly may take quite some time to undo.
Some feel that one death is still too many, and Kayla Pellin said, mortality data tells us who is dying. It does not tell us how many are suffering, nor how preventable that suffering truly is.
The numbers are still way too high. Am I happy it's going down? Yes, but it's still way too high. We have at least 2 people every single week die in our community of preventable death.
I think it's important to recognize that each number does represent a human being.
Over the past 3 years, over 20,000 doses of naloxone were distributed over Manitoulin Island in Sudbury area to help lessen deaths that both government employees and frontline workers agree are preventable. Madison Marier, CTV News, Sudbury.